Hello, everyone. This is Pelin Oğuz. I'd like to welcome you all to our program that we prepare as Istanbul Policy Center Sabancı Üniversitesi Stiftung Mercator Initiative in collaboration with Medyascope. Today we will be talking about heat waves. What are they? Who is affected by them? How can we prepare against them? What's their relation with climate change? And what should the authorities do? And I have two special guests with me today. First, I'd like to introduce our Mercator IPC Visiting Senior Fellow, Pierre Gosselin. And he's currently working at the Quebec Public Health Institute on climate change issues. He coordinated Joint Kronos INSPQ research program in climate change and health from 2004 to 2019. He was also in charge of the health component of the Quebec Action Plan on climate change in between 2007 2017, and he's a clinical professor in preventive medicine at Université Laval. And also with Pierre as our Mercator IPC Senior Fellow, we had a webinar in July on battling heat waves in hospitals and in communities. And also we were very fortunate to have him for our roundtable meeting in September with Ümit Şahin, heat waves and preparation of health action plans in cities with the participation of influential actors, NGOs, and local authorities, which was also very successful. And thank you very much for being at our show, Pierre. And my second guest is a very well-known figure in Turkey when it comes to climate change and public health issues, our IPC Climate Studies Coordinator and Public Health Specialist, Ümit Şahin. Thank you very much, Ümit, for being with us today, as always. Pierre, maybe if it's okay, we can start with you. Maybe we can talk a little bit more about, in general terms, what is a heat wave and who experienced them and how people get affected by them. And what is the relationship between heat wave and climate change?
Yes, thank you. The definition of heat wave is actually not standard. You've got several definitions of heat wave, but over the years, generally, most people agree that 3 days and more of very hot temperatures, that's usually over the 95th percentile of the experience of the preceding years. Taking into account both maximum day temperature and maximum night temperature, both are important. So that's what is now the common definition. Some regions will use higher percentiles if your population is used to very warm temperature. Some regions will use the 97th percentile or even higher. Another way of defining a heat wave is to take into account the extra mortality, extra death that are caused by such a heat wave, and that necessitates more studies, more from the health sector to count the number of deaths and put them in relationship with the temperature. So that's more specific. You can examine the different time of heat wave in the sense that the heat waves appearing early in the season will usually cause more deaths because people physiologically are not accustomed yet to the warm temperature, while the ones that will maybe appear in late summer, end of August or September, can be at least in cooler countries like Canada can be less problematic. So that's usually how you define a heat wave. Heat waves have been present for centuries. The problem with climate change is that they're becoming much more frequent and much more severe. than they used to be. For instance, we studied in the last 15 years historic heat waves for Montreal in Canada, and we had something like 8 or 10, depending on in the last 30 years until the year 2000, for say. But in the last 10 years, we had one heat wave every year, and last year we got 4. Last summer we got 4 heat waves. So it's really increasing in frequency in a dramatic fashion, and all the same, the severity, as we've seen in France, for instance, in 2003, and again in 2006, and for many countries in Europe, the severity is increasing also quite dramatically too. So altogether, heat waves are important because we've seen that they kill. They can kill in the thousands of people. That is, it depends on, of course, on some conditions. Conditions being the length of the heat wave, like the one that struck Europe in August 2003, was preceded by a very hot summer altogether and no rain, and then on top of that, in August, an extra layer of warmth happened. So that created, people were not prepared. Nobody was prepared that time. And it led to really, literally, about 70,000 extra deaths, mostly in old people. It can be your mother, your grandmother, or grandfather. People not specifically about to die, but people that are fragile, have some chronic medical conditions, and that the heat wave just precipitates for a few days in a dangerous zone, and some of them die, of course. Other people we've seen to be quite affected by heat waves are workers, outdoors workers, people working in the construction, in road building, people working in very hot environments, firemen, for instance, or cooks in a closed restaurant. And here in Canada, we've seen young people in their 20s going out for planting trees in cut areas of forestry, and they were going out in early season, May, with a heavy load, not enough water, not enough training, and we had a few deaths. Even last summer in Quebec City, there was a worker on a construction site that was caught in the basement and working with concrete. And at the end of the day, he went in, a young man, 26, he went into a heat stroke because that was just too much, not enough rest, not enough water, and in the end, too much exposure to high degree of temperature. So most people affected will be more on the older side, in the sense that most people will die, will be in their 60s or a little bit younger if they've got several medical conditions. And but some of them are much younger than that. We've seen people living on the street. We've seen people with mental health problems being quite affected, going to emergency rooms, hospitalized, and some died also.
Thank you very much, Pierre. Maybe we can talk about it in the second round a bit more. And now I'd like to turn to Ümit Şahin, and maybe we can talk about how the heat waves affect people in Turkey. Are they also increasing in Turkey? How often do we see them in Turkey? And also there's an article by you and Pierre that has been published recently, excess mortality in Istanbul during extreme heat waves between 2013 and 2017. Maybe can you talk about a bit about this study as well? Thank you.
Yes, thank you. The first, maybe I should start with the awareness of heat waves in Turkey. For example, as Pierre said, for Canada this year, for Quebec this year, in Istanbul, we also had 4 heat waves this summer. And the first one was quite early than you expect. It was in May. The first big heat wave was in May, and the second heat wave was in the end of June. So the first 2 heat waves were quite early, so they can be more deadly in terms of mortality effect, etc. So why it is important to talk about heat waves? Because for many people, this is cultural mainly, that for many people, heat is not something bad, right? So you like warm weather. You always say, if the weather is warm and if it's really hot in the summers, you say that, oh, it's a good weather. But if it's too hot and if it lasts more than 3-4 days, for example, for Istanbul in June, July, and August, if it's about 33 degrees, so you don't have to have 40 degrees of temperature. So even in 33 degrees, if it lasts more than 3-4 days, so it's really deadly. So we need to really understand that heat is really harmful to health, especially for older people and especially people with chronic diseases. Our study that you mentioned, so last year we published this together with Pierre's team in Canada and also with our public health experts in Cerrahpaşa Medical School. So we looked at the heat waves in 5 years, and we have found that specifically 3 heat waves in Istanbul in 2015, 16, and 17, 419 extra deaths we calculated. So this is probably one of the other problems about heat waves. If you really want to look at it as a climate disaster, because think like floods happening all the time in Istanbul, in especially Black Sea region and other regions in Turkey. So we are witnessing very big floods, extreme rainfalls, etc. And many people are dying because of the destruction caused by these floods. But in these kind of climate disasters, you see exactly how many people died and which people. So you know the names of those people. And in the biggest floods, you witness, these floods are killing something like 30 people, 40 people, sometimes less. And if you compare it with the heat waves, normally heat waves are killing more people. So, for example, in the same example in Istanbul, more than 400 extra deaths we have found in Istanbul in 14 days. The long 14 days long heat waves in Istanbul in 3 years, we have lost more than 400 people. But of course, we can calculate this number only by an epidemiological study afterwards. A couple of years later, we compare the number of people who died during the heat waves comparing to the previous years. So you don't know the names of those people. And those people, most of those people are still the same risk groups, older people, etc. But really you don't know them. So I think this is one of the problems about the awareness on the heat waves. And also in our study, we have found that the earlier heat waves The most deadly heat wave was in 2016 June. So if heat wave happened in June or May, so it is because people are not really accommodated to warmer temperature yet, just after the colder, cooler months. So they are not really used to it, used to heat. So more people are fragile because of this heat wave. So I think climate change is also increasing this risk because we know that from a lot of studies around the world that also in the Mediterranean region, a number of heat waves and the duration of heat waves are increasing. Not only the number, but also the duration and the severity of the heat waves are increasing because of climate change. And we know this also from many studies in Turkey, that the number and severity of these heat waves increased a lot. For example, one important study done by Turkish Meteorological Organization, that number of heat waves, the number of days with the heat waves will increase 78 days more than today if we don't stop climate change until the end of century. So what is 78 days? 78 days basically is all summer months. So in the coming decades, if we don't stop climate change, according to today's temperatures, today's references, almost all the summer days will be heat wave. So it's a big problem. And now, starting with today, we need to do something about that. Of course, starting with the raising awareness, but also taking precautions before the heat waves. And I think we are now talking about these action plans, etc. So we need to really put this to our agenda for climate change, impacts of climate change.
Yes, creating the awareness is also one of the first things, because as you're saying, the heat waves are killing more people, but we don't find out about them until very later. And yes. Now we can see that the duration and the number and the severity of these heat waves are increasing with this climate change, and it's continuing the climate crisis. And it is very essential now to develop some kind of heat warning systems and action plans in order to cope with these. How can these plans can be developed in the first place? Maybe Pierre, can you comment a little bit on how you did it, how you did this heat health action plan in Quebec? Maybe you can share your experience with us.
Yes, actually the way it began was that in the late 90s, we had a series of very violent floods, and something that might seem exotic to you, but freezing rainstorm that led to power failures in the midst of winter. So the government was already quite sensitized to the fact that climate was changing. And after that, we were quite impressed because of that prior sensitivity to the heat wave that happened in 2003 in France. So we realized, we created at that time in Quebec a consortium for research and adaptation in climate change, and heat wave was considered as one of extreme meteorological events that should be taken into account. So we started at that time to prepare a first action plan for Montreal. That was in 2004. And then we decided that the rest of the province in 2007 should be prepared too. So it became that heat became one of the hazards of interest, along with floods, along with winter or summer storms or hurricanes and that sort of situation. So we used the same system that addresses those problems usually, and we began to do our studies to see what could be done. The heat action plan in itself included an early warning system, because already at that time we had some studies showing that it could reduce substantially the number of fatalities, the number of people going to hospital or emergency rooms, because simple measures can be promoted in the population, like just knowing in advance that it can be dangerous for you because you're older. In itself, it is a risk factor, because old people don't feel heat as well as younger people. They often don't feel the thirst as much. So you need to be aware of all those little details, so that people in advance can be told to drink more water than usually, even if they don't feel thirsty, to avoid the heat, during the day. Do their walks or exercise early in the morning or late in the evening. So that kind of simple measures can reduce substantially the number of people being affected. Moreover, what we did is to work with nurses and doctors in chronic care hospitals, with the people in kindergarten, so that they expose less the children to the heat. So there are several spots within a city that, if warned properly in advance with a list of things to do, can reduce substantially the health burden of a heat wave. Working closely with the meteorological service is also something important, because the big heat waves that will kill people, you see them coming usually in advance, a week in advance. So you can be, you can be warned in advance as a public health system and a civil protection system, so that you prepare that it's coming. We're not entirely sure, but it's going to be there in 3 days, in 2 days. Oh, it's canceled. But it's better to be prepared and be ready to act rapidly in advance, instead of waiting for the first 100 deaths to appear. So that's the approach that we've implemented in 2010 for the province. And it's difficult to implement because people tend to react instead of prevent. So our first regions, public health departments, were waiting for deaths. We had a system to count the deaths and publish that early, the morning after, every day, a number of visits to emergency room, a number of people being hospitalized. So you could see the numbers go up. And then we had to teach our own public health people that you need to act before that. You don't have to wait. You should, if you're doing your job well, you should not see those numbers increase. So we had to teach our well-trained people to change their behavior and do all those actions in prevention. There are some also to be done by doctors in their medical clinics, because some medicines, some prescribed drugs can worsen a heat wave. If you're treating someone for hypertension, they're taking diuretics that will dehydrate them, that will increase the odds of being affected by a heat wave. And it's the same for some neurological problems, some anti-epileptic drugs, or some other drugs for mental health problems, such as bipolar disorder. They can become very high in the blood when you don't take enough water. So that's all those situations need to be identified, an action plan be prepared, and that we start sending all that information and promoting that in the media and within our public health system in order to prevent that fatalities happen. We've done also a little study, self-reported problems during a heat wave, the ones we don't see, but that we found, and we've done that also in Ontario, not only in Quebec, but about between 30 and 40% of people during a heat wave feel bad. They feel that in their fatigue, they're nauseous, they have several problems. and 12% of them need in the week after to go see their doctor or pharmacist to adjust their medication or to seek treatment for some other ailment. So that's a huge cost to the health system. We've calculated that each wave for Montreal, which is about 4 million people, would cost in the order of $50 million just in medical visits and pharmacist visits. So that's if you're multiplying by 4 or 5 every summer, or a whole summer, like Ümit said, that means hundreds of millions cost related to heat. So that's the way it's been progressively implemented. The good news is that it reduces significantly all over the world, here and in Bangladesh and France and the UK and wherever you adopt such early warning system and action plans. They reduce dramatically by about 50 to 75% the fatalities. So they're cheap to run. Usually you can run a system for a country in terms of information, data, aggregation and warnings and everything for about $200,000-300,000 per year. But you save hundreds of people for that price, which is really cheap, really effective. Bangladesh is the most impressive success story. I believe they reduced by 67,000 deaths the year after the system was implemented. And it's not because they're rich. It's not because they have lots of means to reduce those problems, but it's highly effective.
Thank you very much. I think those are very good examples, because when we think about our own society, and we see that Bangladesh even also made this work and it's very successful, and like fatalities are prevented by 50 to 75% is a big number. And but as you're saying, in Quebec, like it is now, the heat wave is now treated as an hazard. Maybe when we look at Istanbul, we don't really treat it as an hazard yet, and we don't really have that kind of a mechanism to prevent ourselves from that. Maybe Ümit Şahin, when we look at the site, when we look at Istanbul, I know that you're a member of the City Council, also Istanbul, and you've been quite active in these fields, preparing all those necessary information for the local authorities in order for them to prepare heat warning systems and increase local awareness in Istanbul. Can you tell us a little bit about your experience and how Istanbul and we can actually prepare for it, and what are the local authorities should work together with?
Yes, actually in Turkey, there is an awareness for the impacts of climate change in the local level. So both from the central to the local level, that first the environmental ministry is asking all local governments to prepare climate change action plans and to do something against the impacts of climate change. And we know many municipalities, including Istanbul, already prepared climate change action plans, both for mitigation and adaptation. But the problem here is, as I said in the beginning, that heat waves are not really considered one of the worst impacts. So you can find the heat waves as one of the impacts of climate change, but not with a detail and not with a specific prevention plan or something like that. So in order to begin this kind of preparation, as Pierre already said in the very beginning, that we need to define heat wave first of all, because you don't have a universal definition of heat wave. So you need to define heat waves locally. So you need really to define, for example, for Istanbul, you need to define what is an heat wave, after which, for example, in July or in August, after what temperature and how many days these heat waves are causing more deaths. So in order to understand this kind of an information, in order to understand this specific information. So you need to make some epidemiological studies. So you need to collect data first. So the central authorities and local authorities should not, maybe they don't have to do this by themselves, but at least they need to provide data to the researchers in order to understand what is the threshold for heat waves, for example, for Istanbul. So this should be the first step. And after that, as Pierre said, that together with the meteorological organization, so meteorological organization is already doing this. So meteorological organization, as you know, time to time, they warn society that excess heat is coming. But here there is an important difference between excess heat and heat waves. Extreme heat or excess heat is something like more vague, you know, that you can say that, oh, the weather is very warm in these days, but you really don't know if it is in the level of heat waves, because if you don't really define the thresholds of heat waves, you don't really understand which days in the coming days, for example, will be in the heat waves, and in which days you need to take extra measures in order to prevent the deaths and other hospitalization and other health impacts of heat waves. So the first thing we should do is doing some studies, some research about defining heat waves, and then creating a kind of early warning system to make people aware of what they should do, like very simple measures, as Pierre said, that like protect yourselves from excess heat, or don't go outside if you are in the risk group, or drink more water, or these kind of things. And these things, I think, should be done first by the health authorities, by the public health authorities in the central level, but also in the local level. So that's why, as IPC, we are trying to do something together with Istanbul Metropolitan Municipality, the authorities in the Istanbul Metropolitan Municipality, for them to prepare some warning systems against heat waves, because they have the means of communication. They can easily reach people to warn them against the heat waves in the coming days, for example. So they can use their billboards, they can use their screens all over the metro lines or bus stops or whatever. So they can put some warning signs about what you should do if you are fragile or if you are in the risk group. So that's, I think, that can easily be done, and it's very important to carry out. One thing more about the local authorities, that now people are more aware of about the heat island effect. So in the cities, we have something which is really magnifying the impacts of heat waves. And this is if you are living in an area of a lot of tall buildings and asphalt and, you know, concrete buildings, etc., then you are feeling the heat much higher than if you are living in somewhere with the green areas. So, for example, in Istanbul, if you are living in Maslak or Mecidiyeköy or whatever, these very concrete places with the concrete buildings, so you have experiencing an heat island effect. So one of the things municipalities should do is trying to reduce the effects of heat islands by green fields, etc., but also by all these other public policies, they need to reduce urban heat island effect in general. So this is one of the things local governments should do against the health impacts of heat waves.
Thank you very much. And now we can go to the last round, maybe 2 or 1 to 2 minutes. You can have your closing remarks. We can start with Pierre and then continue with Ümit Şahin. And maybe I can ask you, Pierre, but you can also, of course, comment on anything that you want, or Ümit's work also. What are the most effective mechanisms that the local authorities used in Quebec that prevented or helped people coping with these heat waves? What do you think were the most effective ones? But you can also comment on other things as well.
Yeah, just a little comment on the importance of urban heat island that Ümit mentioned, because on top of being hotter than the rest of the cities, it is also where the air pollution is the worst often because of the traffic. If you've got roads and concrete, then you will find cars. In itself, they produce heat and air pollution too. So that's going to be worse for those parts of the city. So the one extra step is to go into preventative measures. Like greening is important, but also promoting active transport by bicycle or by foot, and offering connections within the city so that people can use easily public transit and their bike or whatever. So that's a normal evolution that you want to reduce heat within the city, and that is doable. You already have probably white roofs and white buildings in good proportion that we don't have here. So that's a useful measure, and to reduce in total the number, as much as possible, number of rows, and keep the water within the city when it rains so that it can evaporate the energy, the heat. So all those measures are effective in the long term. About the heat action plans, I believe the importance is to have a graduated approach. So you begin by simple measures. If you have the notion that the heat wave will last longer, then you intensify, you repeat your message after 2 days that it's going to become more dangerous, since we've been 2 or 3 days in the heat wave already, and now people should pay more attention. You should go see your family members that are handicapped or that cannot care for themselves. You should check at your neighbor's door. That is one part of our plan after 3-4 days. And in the end, we have identified hotspots, urban heat island, in deprived neighborhoods, poor people. And in the end, we send social workers. Let's say it's the 5th day of the heat wave. So we send people, policemen, firemen, social workers, to knock at doors. A couple of years ago, we did 42,000 visits at home in those pre-identified high-risk zones of the city, so that we can avoid leaving people alone in their place, just dehydrated and slowly dying because nobody cares about them. So it needs to be organized in a way that if the heat wave is getting worse or lasting longer, that you've got some extra steps to avoid this. We're giving water on the street for people living on the street, and that kind of stuff is also organized and needs to be taken into account as the heat wave progress.
Thank you very much. Now you have the floor, Ümit, for 2 minutes.
Okay, one thing maybe is just to repeat what Pierre said about air pollution. I think that's very important remark, because the first reason is both is amplifying the effects of the other. So especially in the summer days, you have an ozone pollution in the cities, mainly because of car traffic and also heat. Heat and car traffic is causing ozone pollution, and its effects on the lungs and cardiovascular system is also amplifying the effects of heat waves. This is one, let's say, similarity or the connection between heat waves and air pollution. And the second connection, I think, is both are silent killers. So you don't really see who died or who was hospitalized because of air pollution. And in the same sense because of heat waves. So you don't, the doctors or nurses in the hospitals or emergency services, they don't really look at it in this way. They see a patient with a cardiac, for example, infarction, MI or something like this, or an asthma attacks, but they don't really know if this is becoming because of air pollution or because of heat. They just treat it and they don't report it like this because there is no such a system. But both all these kind of things, the pulmonary conditions, cardiovascular conditions, and many diseases are caused by heat waves and caused by air pollution. As all we know that WHO, World Health Organization, always, they did this research a couple of years ago that every year more than 7 million people are killed because of the effects of air pollution in the world. So, but we don't really know exactly who is killed because of air pollution. And in the same sense, I think we need to take into account that both air pollution and heat waves are silent killers, and we need to take precautions before we experience a similar very big heat waves like one in Europe in 2003, because only after that big heat wave in 2003, many countries started to take action. I think in Turkey, we need to take action beforehand and before we experience such a big disaster because of heat. And I think, unfortunately, it will come because of climate change. So I think we need to, both from the central government and local governments, we need to take action as soon as possible.
Thank you very much. I hope the steps initiated by IPC and by Pierre Gosselin, by Ümit Şahin, is going to pave the way for preventive measures to take place within those local authorities. I would like to thank you very much, both of you, Pierre Gosselin, Ümit Şahin, for being with us today and having this informative talk about heat waves. And thank you for our listeners, and we will see you next week on Thursday again. Goodbye.